I'm Faz Shakir.
I'm Amanda Litman, and this is Battleground. Faz is still gone this week, spending time with his very cute new baby. This week on Battleground, we're talking to Ai-jen Poo, co-founder and executive director of the National Domestic Workers Alliance. Ai-jen Poo, welcome to Battleground.
Thank you so much, Amanda. I'm so happy to talk to you.
Let's start with some level setting. Can you tell folks a little bit about what the National Domestic Workers Alliance does?
Yes, we are an organization that works on behalf of the 2.2 million, mostly women, who work inside of our homes as nannies, house cleaners, and home care workers. They do the work that makes everything else possible, but it's work that's undervalued and invisible, and it's mostly women of color who do this work, and our job is to lift up this workforce, build power, and make these jobs good jobs that you can take pride in and support your family on.
You have done interviews where you've talked about seeing your mom and your grandmother take care of your family and community and how that really influenced you to get into this part of organizing. Is there a specific caregiver early on in your career that you think about when you do this work?
Definitely, I think growing up watching how much of the work that my mom and my grandmother did was kind of taken for granted and not accounted for or recognized, and yet it was so essential for everyone's existence. And then I think when I moved to New York, it's just so striking. Anyone who's ever walked the streets of Manhattan on a weekday, all these women of color pushing white babies in strollers, and it's the most visible, invisible workforce. And you can't help but just stop and think about how it is this army of women of color, who support the families that operate everything else in our economy. And so it's like the work before anything else can happen. I've volunteered on a domestic violence hotline in New York City that was for Asian immigrant women survivors of domestic violence. And many of them were calling about their abuse and the dynamics there, but one of the biggest challenges they faced was the fact that they were in jobs that didn't pay enough to make ends meet, and they were worried about how they were going to support their kids if they left their abusers. And I just remember so many of those stories late at night, just being like, wow, how could it be that so many women are working so hard and doing everything in their power, and it's still not enough to keep themselves and their families safe?
I was raised in part by a nanny from Trinidad who lived in our home. My parents helped her get her green card, sponsored immigration. And then later in my teenage years, a Filipino woman lived in our home to take care of my grandmother. So I lived with both sort of ends of that caregiving space.
Yeah.
And the more that we talk about care infrastructure as part of this sort of legislation, reconciliation, sort of governing philosophy, my mother and my family would not have been able to survive without both of those women as part of it.
That's
taking
right.
care of us as kids and taking care of my grandma at the end of her life.
That's right.
Can you, for people who may not be familiar with the term care infrastructure, can you define that for folks?
Well, sure. So I think most folks don't even really think about infrastructure in general, but it's been so much a part of the policy conversation right now because when we think about recovering from an economic crisis or recession, one of the first things that Congress does is invest in infrastructure jobs that are about repairing roads and bridges and tunnels. And so we think about physical infrastructure, and we think about it in terms of what gets us to work every day, right? And what enables the economy to function, what enables society to function. And the thing about it is, because the realm of care has largely been assigned to women and sort of assumed and taken for granted that women will do, we haven't even thought of it as infrastructure, but it is actually the most fundamental thing in our lives that enables everything else to happen and function. And, I think Senator Casey said recently in a hearing, it's like some people need a bridge to get to work and some people need childcare to get to work. Even the men who are going to be repairing our bridges and tunnels need care in order to get to their jobs, to do their work. And so we have started to talk about care as infrastructure because that is what it is. And in order for us to start thinking about it as something we need to be investing in as a society, as a nation, we have to start thinking about it in that way. It's a public good and it's absolutely essential.
So there's a couple components to this. There's the people who are doing the work, the caregivers, and then the people who need the care or who benefit from someone else doing the work. Let's start with the people who need the care. There are kids, and then there are sort of the elderly, I think, is the biggest bucket. So there's certainly some others that I'm almost inevitably leaving out.
People with disabilities.
People with disabilities.
Yeah.
What are we currently doing now for the folks that need the care, and what should we be doing?
Everyone needs care at some point in our lives. The reality is that as a country, we need more care than ever before because the baby boom generation is aging. There's 4 million people who turn 65 every year. And then millennials are having babies. 4 million babies are born every year. Huge needs for care on both ends of the generational spectrum. And we have very little in place to support that. So if you need childcare, the average cost is about $9,000 per year. And the average cost of a private room in a nursing home is about $100,000 per year. But 60% of the American population makes less than $60,000 per year. So the numbers just don't add up. People can't afford it. So we have some programs in place that support very, very, very low income people to get access to care, child care, and you can completely spend down your assets and get access to home care through Medicaid or long-term care through Medicaid. But for most of us, we're in that in-between space where we're having to basically pay out of pocket a lot of money to be able to afford to care for the people we love. And what we have is essentially an overworked and underpaid caregiving workforce that we rely on. Child care workers, early childhood educators, home care workers. The average annual income of a home care worker is $17,200 per year. Can you imagine trying to support your family on that amount of money? And so because the wages are so low, we have really high rates of turnover and massive home care deserts all over the country where people who need the services and are eligible for some of these publicly funded programs can't get access to the services. And the whole conversation right now is about how, coming out of this pandemic, how can we invest in our caregiving infrastructure in a way that both makes care affordable and accessible for the families who need it, and raises wages and makes these jobs good jobs that you can really sustain in. And we are closer than we've ever been to realizing that potential. It's actually a game changer. And so I feel hopeful, and the challenge is enormous because we've underinvested in care for everyone for so long.
Thanks for watching. You can get the full episode of Battleground on the Recount streaming daily or listen to it wherever you get your podcasts.